and that is Eradicating Extreme Poverty, Emerging Lessons and Approaches. We all know Bangladesh has been doing tremendously well in terms of tackling poverty. It is headed to be one of the middle income countries of the world. And I think it's a very timely approach to look into this sector and see what we have achieved and where it still needs to progress from here. A bit of house rules before we press on to the main agenda. This will be divided into 2 sessions. In the first session, we'll have the panelists, and also in the second session, we have the other panelists to talk. And once first session panelists spoken, the floor will be open for discussion, question and answer. And please be mindful, all your questions needs to be put into the chat box because we have quite a few panelists today. We will strictly keep it as chat box questions only. There will be no one from the floor speaking and asking questions. And believe me, I will be very strict about that. So please do make sure you are putting into your questions in the chat boxes, and we will make sure that they are being asked to the panelists. Also, during the panelist presentation, you can do and put your remarks there. Our volunteers will be taking it out. Each panelist will have 10 minutes to 7 minutes discussion, and I'm going to keep it quite strict about this. And what the agenda, as you can see, we have going to have is factors that led to success of extreme poverty programs in Bangladesh, and will highlight the emerging challenges that need to be tackled. So this will include concerning the indigenous and ethnic minorities, people with disabilities, COVID-19 impact on the economy, social safety nets, urban and rural poverty, farm and non-farm interventions, and targeting strategies for extreme poverty. So my role will be actually welcoming and opening the floor for everyone. And this is the most time I would speak, right? Okay, so let's move on and start this important episode. So I have already mentioned the question and answer. One other thing, this session will be recorded and is going live on Facebook. So please do share amongst your networks or share within your social media pages about this being live broadcasted. So let's welcome our first speaker. So the welcome address is from Mr. Ramesh Singh. He's the Country Director for CARE Bangladesh. Ramesh Singh, over to you. Yeah, so the very universal question nowadays, you have been muted. If you can unmute yourself, please, sir. Thank you.
Thank you, Ms. Saida. Welcome, everybody. And it's this important deliberation today. And without further ado, I'd like to start and say that the forces driving Asia's rapid growth, new technology, globalization, and market-oriented reform has lifted, as in Bangladesh, millions out of poverty, but also extreme poverty especially, but it also remains kind of fueling force for rising inequality in the region and in countries as well. But from there, COVID has kind of added a very complicating dimension to it. Like Bangladesh, like many other countries across the globe, has been passing through this unprecedented and challenging times. This pandemic has been affecting all of us in a multifaceted way. In our social and economic spheres, we are not only losing lives with deteriorating health conditions, but also going over social and economic shocks, and in particular having significant negative impacts on economy, employment, and livelihood, social harmony, and has increased level of poverty and added emerging new poor in Bangladesh. Women in particular are also having disproportionate impact on their engagement and participation in the economy and livelihoods in particular. So the current, if you look at the current trends in country, we are all aware that our upward poverty rate in Bangladesh has increased substantially due to the impacts of COVID-19. Lower or extreme poverty rate has also increased in the meantime, and it's all across rural and urban areas. If you look particularly into the COVID impact on poverty, it shows a slightly gloomy picture. According to the government's planning commission, the recent nationwide closure of all economic activities for 2.5 months has doubled extreme poverty in Bangladesh from 10.5 of the population to 20.5 as of June 2021. The commission also estimated that the incidence of poverty increased from 20.5% to 29.4% as a considerable number of people lost their income due to the coronavirus fallout. Findings from a local survey that depicted that more than 80% people have reduced their expenses on food consumption, more than 60% people have borrowed money for their daily expenses and for survival. Around 47% people have reduced taking protein, and some have reduced their number of meals per day. These are quite devastating impacts of COVID. Now, based on the country's glorious achievements in reducing poverty and from the recent learnings and reflecting back on the impact of COVID-19, it is high time now to explore and focus on innovations and sustainable programming for poverty reduction. And today's webinar, I hope that these speakers and panelists will particularly bring together and sharing their thoughts, knowledge, and opinions with the rest of us and facilitate discussion of some of the emerging models and approaches to reduce extreme poverty in even a more challenging scenario like this. I'm confident that with the application of innovative methods and approaches and government of Bangladesh fostering collaboration amongst donor communities, private sectors, NGOs, INGOs, Bangladesh will continue to build back and build back better in reducing poverty and tackling the COVID impact. Finally, I'd like to convey my sincere gratitude to organizers, panelists, and participants to arrange, facilitate this very important, timely, and interesting discussion and to find out new solutions to reducing extreme poverty in Bangladesh and continue Bangladesh's growth story forward. I wish everyone a successful, safe, and fruitful webinar. Stay safe. Thank you all. Over.
Thank you very much. Thank you very much, Mr. Singh, for your invaluable input and the welcome address. CARE has been doing wonders in Bangladesh, and not to mention the important contribution of our private sector and NGOs and INGOs in eradicating poverty. And it's a partnership work. And obviously, thank you for your welcome speech. Now, moving on to the next speaker, I would like to welcome, that's our keynote speaker for the webinar, Mr. Rubaiyat Sawa, Managing Director and Lead Consultant, Innovation Consulting Private Limited. Just to say that as our keynote speaker is speaking, innovation has been a very, very integral part in delivering all these policy dialogues, I would say, and the research and everything that we are going to gather is going to be accumulated in a policy paper and it will be published later on. So I would really request everyone who has joined, and I can see people still joining now, to kindly fill in the form and share the form with your details so that the very important discussions could be emailed to you and we don't miss anyone from this very important discussions that we have been having throughout the series. So I would like to welcome Mr. Sawa with his presentation. Thank you, sir. You've got 10 minutes.
Thank you so much, Saima, and welcome to everyone. We're talking about eradicating extreme poverty, the lessons from Bangladesh and the approaches. And also I'd like to highlight a few of the learnings that are emerging in recent time due to COVID-19 as well. A couple of years back, we had this diagram coming out in the household income and expenditure survey. And it was it made quite a round, and it was quite fascinating to see. And it said that the extreme poverty and poverty rate in Bangladesh declined significantly since 2000. And as you can see in this diagram, the extreme poverty rate declined from 34.3% to 12.9%, while poverty rate declined to 24.3%. So that's the upper poverty line. And these are basically consumption-based indicator using the $1.9 purchasing power parity basis to define poverty. Now, so it made quite a round, as I said, but the point is, Bangladesh is not a peculiar case in the world. As you can see, the whole world has been progressing in terms of eradicating extreme poverty, with its little, exception of sub-Saharan Africa. There has been a major decline, and Bangladesh actually is not really performing better than some of the comparator countries like Pakistan, which had 3.9% of extreme poverty in 2015, Sri Lanka, which had 0.8% extreme poverty in 2016, and Bhutan, which had 1.5% in 2017. Now, so the question therefore is, what is there in the Bangladesh story that the world should be aware of? What is the pride coming from? It's coming from not from the fact that we are doing it better than the whole world. It's not coming from the fact that we are accelerating ahead of others, but it's coming because of the fact that we are doing it against some unique challenges that are very unique to Bangladesh. What are these challenges? You know that Bangladesh is in the, hot seat of climate vulnerability. It ranks number 7 in the world in long-term climate risk index. And also it accounts for 70% of the global storm surges, and it has been increasing. So there's a continuous threat and pushback from climate vulnerability. We also have the highest population density amongst the least developed countries. And as you can see in this slide, our average, which is 1,239 people per square kilometer, is way above the average for the least developed countries, which is just about 50 per square kilometer. But what is also not spoken about that much is that within the small land that we have a huge social, cultural, and environmental diversity. The river and river basin diversity of the world's largest delta, the Haur and floodplains ecology, the remote shores, the hills and sparse indigenous population, the large coastal areas and mangrove forests, world's largest refugee base. All of these contribute to a unique system, a unique economic system where one approach that works in the north doesn't work, let's say in the south, or the approach that works in the south doesn't work in the east. So we are, in a very diverse setting, and the policy that we have is not homogeneous. It's extremely heterogeneous poverty. And also, what we don't really speak about is the fact that Bangladesh has the lowest arable land per capita, second lowest actually in South Asia. But it's still, we managed to feed our people and we are food secured. So that's a tremendous job. Now, we are progressing against these challenges, the social and structural challenges. And this means that pushing the people up is harder in Bangladesh. And also it means that the threat of slippage is very high. Now, what do I mean by the threat of slippage? If you define the poor into 3 categories, extreme, poor, and then non-poor, what you can see in this slide is that the red zone, the extreme poor, they have extremely low resources that they can bank on to move up. They're constantly in shock of natural, economic, and health disasters. And they also have very low economic diversity, and so they cannot bounce back. But those who are in the poor category, even though they're building assets and resources and diversifying their economic engagement, they're always in the risk of market failure because they are in between and the market is not really working on behalf of them. Their bargaining capacities and etc. are very low. So they're also vulnerable, and the natural vulnerabilities and the economic and health shocks remain. So they're also vulnerable to slippages. And what we have seen, I mean, we knew it before, but COVID has shown it with a very hard-edged sword that the non-poor are also extremely vulnerable because of the threat of the market that dysfunctions, and also the threat of urban poverty and the urban economy that they're dependent on. So the slippage risks are very, very high. Now, therefore, the extreme poverty programs in Bangladesh had to innovate, and they have to use a very complex program setting, which involves a public-private mix of interventions, which we often call push and pull, where the households, CBOs, NGOs, and private sector and the government play a symbiotic role. And you can see in this slide, the graduation and the life cycle approach that Bangladesh has more or less been applying. And you can see as an area of interventions from the extreme poor to the poor and the non-poor. And you will see that these interventions, it ranges from asset transfer to social safety net, to savings group formation, community mobilization at the bottom. And it starts to evolve in the middle where the market forces start to take over. As you move up, the market forces are more prominent. So in this push and pull metrics, what I've just shown you on the previous slide, this has been very unique to Bangladesh, this evolution. But also, we shouldn't forget that there are some other structural factors that have contributed to the progress of Bangladesh. One being the remittance. And Bangladesh remittance, it grew significantly, even though the percentage share have declined recent years. We still have $21.693 billion in remittance coming in 2020. And then also the female labor force participation, even though it has slowed down in recent years, from 2005 to 2010, they pushed us up. The total fertility rate decline has also been a factor, and the education attainment has also been a factor in contributing to our growth. But also the employment in industry and service sectors, it increased significantly during this period. And this all contributed to the eradication of poverty that we are seeing. But the problem is that there are signs that this is slowing down. Now, what are the signs? For example, the contribution of GDP to poverty is showing down, which is shown in the elasticity of poverty reduction to growth, which fell from 0.88 to 0.73 in the period 2010 to 2015. The consumption growth slowed down from 2.3% in the period 2000 to 2005 to 1.2% in the period 2010 to 2015. And also, we're seeing that, rural poverty is declining at a faster rate where urban poverty almost remains stagnant. And there is divergence arising between the east and the west of the country. So the poverty rate acceleration that we had is actually slowing down. Now, the question is why the acceleration is slowing down. I would say that there are several reasons, and I will identify them as sticky poverty. And I will say that we are dealing with the sticky population, which did not move out of the poverty trap despite decades of interventions, which means these are the population which are the hardest hit, which are the hardest to pull up from the poverty trap. And why is this sticky poverty happening? One is we have 6.94% population living with disability, and our research have always shown that extreme poor households with a family member with disability are more susceptible to slippages. We have 2 million ethnic minorities, and there has been systemic growth problems and challenges that are stunting the progress of our ethnic minorities. We have 4.4 million people internally displaced in 2020, which shows the extension of the slippage risk happening. And also, we have female-headed households increasing at a higher rate. And our surveys and studies are always showing that extreme poverty is often dire amongst the female-headed households. We have the sex workers, transgender, and the marginalized communities who continue to struggle because, despite social safety net supports and so on and so forth, the systemic failure with the societal norms have not been addressed, which continue to stunt their progress. And then we also have rising life expectancy, which has increased the number of old age people among the extreme poor, and they are often abandoned by their family members. And these are the people who are really hard to move through the interventions that we are having. Now, between 2014 to 2016, I did a research, and I've several research actually. And what I was seeing is that the graduation pathway is not at all linear. It's very erratic, and there are some households which have factor conditions. You can see them in green, who have a much steeper progress out of poverty. But then there are households who, because of their factor conditions that they own as the baseline, they take much more time to evolve, and the slippage risk is much higher. So whatever poverty programs we're talking about in the future, we'll have to be aware of this. And finally, the COVID-19, which have exposed some of our vulnerabilities, which includes the urban poor. We have seen that they don't have the shock absorption capacity as much as the rural poor is because of their low, savings, and so, and also their dependency on daily income. And also we have seen that households dependent on rural non-farm occupations are more vulnerable than households dependent on farm incomes. We have seen that food consumption and the consumption basket has slided down, which means in the future, the consumption-based poverty analysis will show much more poor, which means there are more poor joining. And also we are seeing reports of dropouts and early marriage and adolescence happening, which would in the future increase our poverty burden. Now, moving forward, we will need two types of interventions. We will need the push. We need to recognize the new poor, bring them under social safety net coverage. We need to strengthen our urban social safety net programs. We have to introduce safety net programs for 408,000 returning migrant workers, and this is increasing. In the future, the remittance will continue to decline, so we have to find a way of rehabilitating our migrant workers. We have to introduce health vouchers because there is a new risk of non-communicable diseases increasing. And then social safety net coverage for ethnic minorities, transgender sex workers will have to improve. And then the social safety net will also have to become systemic, multi-level, and multi-sectoral, and take the life cycle approach, which the NSSS 2015 envisioned. And finally, the pool where we will need the investment for climate-based interventions will continue, and it has to be strengthened. The food and nutrition security will have to be further strengthened so that slippages don't happen. And we need to increase our investment for economic rehabilitation of the people with disability and ethnic minorities. And we have to diversify our economic centers. Softer skills. And finally, we have to incentivize savings for the poor and promote asset diversification. I took a few minutes more, but thank you so much, Sarah.
Thank you so much, Mr. Rubaiyat Sarwar, for your very, very invaluable input and the excellent presentation. I think we are having quite a few questions already following your presentation, which is very good. Please do keep the questions coming. And you have actually tried to give all the solutions in just 10 minutes. Well done for that. And it is not easy for anyone who's going to pick up from the lessons learned and to the way to move forward. But these are the ways actually we can look at. But thank you very much. Innovative presentation from the head consultant of innovation. Thank you. I'm just going to open up for the floor for our panelists. And like I said, we are going to have the panel members first in the first session, and then we will move on to the first set of Q&As. So without further ado, can I please welcome Dr. Saima Hock-Bidisha, Professor, Department of Economics, University of Dhaka, as our first panel member to speak. Because Mr. Sarwar has taken a bit more few minutes, I would request you if you could kindly stick to 7 minutes.
Okay. I think Thank you so much. First of all, I think it would be good if you can just interrupt me if I am taking too much of time. Okay, that would be great. Okay. First of all, thanks to Care Bangladesh and thanks to Innovision for inviting me. When we are talking about poverty, I think for the last 1.5 years, we have been talking about poverty, and there has been quite a lot of research on poverty as well. Now, from that point of view, I think when we are talking about poverty at this point, we need to distinguish between few aspects. One is the difference between the extreme poverty and the measures for extreme poverty and poverty as a whole. Secondly, food poverty and overall poverty. Thirdly, as has been pointed out, like there has been some new poor people. So existing poor and the new poor. And finally, there is a difference between poverty and vulnerability. And the speaker who just spoke before me, he was talking about this vulnerability to poverty, the slippage into the extreme poor or from non-poor to poor. So this type of distinction. So when we are designing the policies framework, we must keep these aspects in mind. So while talking about this, there are several issues that we must think about. One is like a little bit different issue we generally don't talk about much, which is the issue of price volatility. Because I think when we are talking about poverty and when we are talking about extreme poor people, it is extremely important that we keep the price level at a tolerable rate for the poor people, not only for the poor people, the middle class people as well. And for this reason, efficient OMS system, increasing and expanding the capacity of OMS and having proper social safety net program, that is one important aspect. Secondly, we can think about introducing, it has already been introduced, but introducing national ID card as much as possible to reduce the exclusion and inclusion error in the social safety net program. Secondly, when we are talking about poverty, then we talk about the poverty reduction. So when we talk about the poverty reduction, we must keep in mind that traditionally, our idea for poverty reduction is through the safety net program. And through the safety net program, we generally focus on the demographic categories. We focus on some income groups. But I think especially COVID has given us a lesson that we also have to focus our discussion on occupation-based poverty as well. I did some research in recent years and I managed to publish 2 papers, which is dealing with the occupation-based poverty and occupation-based vulnerability. And what we have seen, just what I have seen in the COVID as well, like some categories, they are maybe in terms of the poverty, the scenario is not that strong, but when we are looking at the vulnerability aspect, then we have found that certain occupation groups are very much vulnerable towards poverty. So any type of shock, like COVID type of shock, these people, they can fall below the poverty line, and those people who are already poor, they can fall within the extreme poverty line. So that's why occupation-based, specially targeted program based on data and factual figures, these are very important. Another issue is like when we are talking about poverty, we also have to see that especially when we are talking about urban poverty, there is a big issue related to the social safety net program and the type of intervention that has been provided for the urban poor. But interestingly, that although rural poverty and urban poverty, if we compare, rural poverty is higher, but if you look at the trend and pattern, and if you look at the recent COVID impact, we have to keep a serious eye on the urban poverty reduction. And from that point of view, I think it's extremely crucial if you look at our social safety net program, because in terms of the social safety net program, I think 5 programs this year, those are related to the urban poor people. So in terms of the 124 program, I think. So from that point of view, it is extremely important to have to extend our coverage of social safety net program. 1, to include the new poor. 2, to think about the occupation and to redesign about the occupation-based poverty. And 3, the targeting the slum dwellers and targeting the urban poor people. And while talking about this urban poor, there's also another thing that we can think about the suggestions that has been provided in the National Social Safety Net program. Those suggestions are related to the, 1 second please. Sorry, I have a small baby and he just came here. Okay, so another thing that we must keep in mind that when we are talking about social safety net program, that National Social Safety Net strategy and National Social Safety Net strategy is proposes to have some comprehensive, specific, and rather than having more than 100 programs, to have some separate like 10, 12 programs, more comprehensive to reduce the risk, and to have more per capita household-based allocation as well. So because we don't have the, if you look at the per capita, then the per capita, in terms of the per capita term, the social safety net allocations are not that large. So that is also important. And finally, I think there is another point that we must keep in mind, that when we were talking about the poverty and vulnerability, there are certain other groups that we must think about it, like certain groups, like one is the, when we are talking about like the migrant worker, then we have to think about the special pockets that we have across the country. Like there are special pockets of people, climate vulnerable people, and special poverty pockets. And we must also keep in mind that our poverty program must also focus on the females as well, because due to COVID, a lot of females have lost their income and lost their earnings. So if we want to think about those people, then we must keep in mind that how we can incorporate them. Those people who has lost their job, we can think about those females, especially those, there are a lot of females who has lost their job in COVID. There can be some specific program, and the specific programs can be finding the new sector. So what can be, and to provide skill for this new sector. So what can be the new sectors? One new sector can be the care sector, which is very important, and to provide skill in the targeted areas, like in the slum areas for these people. And there can be some cooperative-based, female targeted small scale loan scheme targeted to those people who have lost their job in the slum area. So that is something that can be done as well. And on top of it, it is important to provide, to think about the social safety net program above and beyond the providing some mere basic necessities. It is important to provide and think about safety net program in terms of providing the skill training program, basic education program, and to link the people who are in the urban slum areas and different slum areas to the supply chain and to the consumers of the type of products they might be engaged to. So these are some of the issues that we must keep in mind. And when we are talking about COVID, my final word would be that we must integrate the CSOs, we must integrate the local representative, we must integrate the NGOs and occupation-based representative in case of the poverty reduction program. And otherwise, it will be very difficult for the government to tackle all of the poverty reduction program by itself. So integrating people at different sectors and to provide and to in the targeted areas, and to have having some specific zonal based policies based on the slums that are in the different zones, that could be one alternative that we can think about when we are talking about targeting the urban informal workers. So I would stop here. Thank you.
Thank you very much, Dr. Haq, for your invaluable input. Like you have correctly pointed out that what policies are needed to address this extreme poverty among households dependent on urban informal economy. And what you have rightly pointed out, the integrated approach to it and not the segregated approach, the intersectional approach to it. And one thing that really comes to my mind is Bangladesh is no longer a purely rural economy anymore. It is actually growing so fast that the shapes and the forms of the rural economy that we started 50 years ago is gradually evolving. It will be interesting to see how the recovery process, especially after COVID, we are using in order to come out of it. Thank you very much for your time. I am aware that you may have to leave us, but there could be a few questions, but I would kindly request you if you could stay with us a little longer till the question and answer sessions. Then if there is any question or answers, you can answer. Otherwise, we will make sure our volunteers send them to you so that that could be answered. Thank you. So moving on to our next panelist. So it will be a joint presentation from Fatima Jahan Seema, Social Research Coordinator, Pearl Unit Care Bangladesh, and Dr. Merul Islam, Senior Director, Pearl Unit Care Bangladesh. And they will be focusing on what are some of the effective strategies to ensure targeting and inclusion in addressing extreme poverty, and what are some of the factors enabling sustaining graduation while elevating extreme poverty. So they will be talking from their experience from the private sector. Can I request them both to present their presentation, and your time will be 7 minutes as well. Thank you.
Okay, thank you. Thank you, moderator. 7 minutes is challenging, but let's see what we can actually share. As you all know that over time, universal programs have faded away in favor of targeted interventions. And the need for targeting has become conventional wisdom, and the success of anti-poverty programs is commonly judged by the accuracy of the targeting approach. And you know that proper targeting allows for maximum benefits to be directed towards the poor while minimizing expenditure on the non-poor. In a nutshell, it actually helps make programs more efficient. My previous speaker also actually touched upon the importance issues of proper targeting, and effective ways of targeting can actually bring a lot of success of our intervention. Though we know that extreme poor are often so socially isolated, and most of the time they don't even know what assistance actually exists and how to go about getting it. And the extreme poor affected by riverbank erosion along the embankments of the Tista or Jamuna, and extreme poor living in coral slums or in urban area are not same. So there are a number of methods actually has been tested in Bangladesh and worldwide to target more efficiently. And the methods are like include activity targeting, direct targeting, characteristics targeting, geographical targeting, self-targeting, and community-based targeting. My previous speaker also talked about pocket-based targeting to include the vulnerability and other exclusion criteria for better targeting. As I agree with her, we found, and research also shows that community-based targeting getting growing emphasis, since it is evident that communities are efficient in identifying and transferring benefits to the poor. As we all know that local definitions of poverty are more contextualized and can capture community-specific traits. However, the targeting performance of community-based anti-poverty programs also shows that simply relying on local community knowledge may not guarantee the success. So what we should do, we need actually a good combination of methods, including community engagement. And from CARE Bangladesh experience, we found that good strategies is to follow actually multi-tiers of targeting criteria. In each case, we found that the geographic tool is used as the first tier to select the areas where program will operate. Communities features in the subsequent tiers, they are responsible for intra-community selection. And while we actually do select district and sub-district, first we actually try to focus geographically identified different areas by reviewing and analyzing government of Bangladesh statistics and research shared by the World Bank, World Food Program maps prepared on proportion of poor and extreme poor population, which also includes disaster proneness and nutritional status of the country by specific areas like districts and sub-districts. So while we are targeting, we actually think that most important thing is to actually consider both essential criteria like food security, income, assets, and also the supplementary criteria like a household with women-headed, a household with actually dependent on work of their children. These are all important factors to consider. And we found that there are 6 selection strategies which can make program more effective and which is drawn from different knowledge streams. For different contexts, it can be used. Number 1 is categorical. So prioritizing households that are frequently found to be extreme poor, for example, households with members who are chronically ill or disabled, and households that are dependent on the work for their children. Number 2, geographic, concentrating efforts in the poorest regions, upazilas, unions, and paras like sub-unions of the country. That needs to be included in our strategies while we are targeting poor. Number 3 is wide stakeholder consultation, which is very important, engaging with wide range of stakeholders, including local elites, UP members, religious leaders, other NGOs, and macrofinancial institutions to bring them all in a consultation to identifying the most vulnerable villages, extreme poor area, people who are living in the poverty. So their consultation is very much inevitable to find out the effective way for targeting in a better way. Community-based targeting involving communities in identifying the extreme poor through using participatory methodologies. In Care Bangladesh, we have a designed approach and analytical tools, which actually includes well-being analysis, poverty mapping exercise, doing social and resource mapping, which actually enable us to identify the primary, secondary, and tertiary paras. And it also gives us the opportunity to interact with the different groups of people and to target who are the most vulnerable. Household mean test is very important thing to checking that a sample of households are extreme poor using a set of criteria. And number 6, I think it's very important to have a self and peer group certification. So you know that in the community, people know each other. And if we go and ask and seeking self and peer group validation, that can actually help us to identify the household who are extremely poor. Well, we talk about the targeting, inclusion comes inevitably. And we found a number of scholars also have argued that communitarian values actually play an important role in determining program outcomes. So in Care, we actually try to create a community ownership through ensuring engagement of people across different sessions at multiple levels. Because we don't want, while we are targeting, we don't want to try to create an artificial boundary for the extreme poor. Rather, we want to build a greater social cohesion among and within community. As we all know that the society and community is a heterogeneous nature. So what we do power analysis, and power analysis actually help us to take political economy consideration of balancing the needs of the poor and the vested interest group of middle and upper strata. So that while we actually make all of them engaged in the development process, it actually helps both way to share the mutual interest and benefits. And in our intervention is actually informed by an in-depth gender and power analysis that actually helps us to identify the distinct needs, roles, responsibilities, vulnerabilities, and power dynamics of and between people of all genders. So what I would like to re-emphasize that for inclusive and effective targeting, it actually requires focus, attention, and action through proper social analysis. Having a limitation of time, I'm not going to expand more, but if I have questions, definitely I'm going to answer it. Now I'm handing over to Mehrul Bhai. Mehrul Bhai, over to you. Thank you.
Thank you. Thank you. Dr. Islam.
Thank you, Simapa. Thank you, moderator.
I just emphasize the time. Thank you. Sorry about that, but I think really.
Thank you so much. I'm conscious and aware of that. I just wanted to first of all start with the context. How important is context to talk about sustaining the gain of the interventions or particular project? And we have recently done this particular piece of work, which was a project funded by ex-DFID, currently FCDO, a project called Shetu. And the project ended in 2015. And we just have completed a post-project evaluation study in 2020. And I'd just like to share some of the emerging findings. I'm not talking about actually graduation itself, but talking about some of the enabling factors which sustains graduation. To start with, I think if we look at the keynote speaker and Dr. Bidisha, once again, it is clear that a combination of intervention around economic, social, and political is critical to actually eradicate extreme poverty in particular. And particularly this post-project study once again demonstrated and clearly demonstrated the need of a multi-pronged strategy for eradicating extreme poverty. The other important findings emerging out of this study is that the social cohesion and collective actions among extreme poor and poor is very, very important. The other point is we found out that since in that particular project actually prepared a vision for that particular community, and creating a vision of community and working around that is central. And therefore, it seems that community members and participants of the project are still continuing to be solid in a kind of community cohesion, and they still continue to have collective actions. I think the point I just wanted to raise is the fact that we talked about resilience as well. And I think one of these resilience issues about probably poor and extreme poor is also social resilience, and therefore it is important or central to have community solidarity or collective actions amongst poor and extreme poor to actually eradicate poverty. I think the other enabling factor we already talked about is actually gender. Is very, very important. Age is an important factor. We continue to see that participants aged between 30 to 40 years has been doing much better than the other household categories as well. And sustaining gains of all these interventions seem to be accrued by most of the households who has a permanent job and also a little bit of petty business as well. I think the other point I would like to highlight here, there is a clear evidence from this particular post-product study that sustaining gains among the household, amongst the lowest, led by households who are employed as domestic maid. I think that's a very, very important and interesting discussion and we need to make. I think we all talked about, the keynote speaker talked about multidimensional intervention. And of course, economic intervention is so critical. But the point again emerged out that since that particular project actually led local approaches to market-based, what are some of the local business opportunities? What are the skills available? And the project actually based and built on the intervention around that. And it seems to be working well. And therefore, I think in an extreme poor or poverty reduction program, it is important to identify the local opportunities and tap and provide them baskets of opportunities. And this particular household seem to be working very, very well. I just would like to share another highlight which is important. I think Dr. Bidisha mentioned about the occupational hierarchy. It is interesting to look at between 2015 and 2020, there are a sort of movement around occupational hierarchies. And we also have interested to note that even ag laborers who are working, who are actually wage earning rate has increased and they're doing very well actually and coping with the current situation and doing better multiple with other minor livelihood income opportunities. So I think ag labor coupled with income activities can also actually sustain graduation once again. The other point, households, we talked about the value of information and linkages, and particularly poor and extreme poor lacks that. And that particular project facilitated and established linkages at different levels, in particular with Union Porishad, to get access and services, and they seem to continue to gather that. I think one of the important point, once again, is it is evident that sometimes, asking services on an individual basis doesn't work. I think when you have a solidarity of poor or groups of poor, then it's actually much more easier to negotiate, services, supports, and actions and goods from those particular community. Maybe I will stop here because we don't have much time. But the final point I just would like to make that I think with a positive note that couple of community sort of households when we interviewed, they just mentioned Hama kajer or ব্যবসার সুযোগ দেন আমরা রিলিফ চাই না. So you can clearly see there are a lot of positivity and inspiration. I think we need to prepare enabling environment and we can do it well. Thank you very much. Thank you, everyone.
Thank you. So like I said, we do have very, very limited time, and how we are going to progress is very, very crucial. But I am very thankful to our presenters to, keeping it on time, be mindful of time as well. Thank you very much, Dr. Islam. So we, in the first session, we do have 2 more speakers to follow, and then we will be opening the floor for our first Q&A session. So can I please welcome Mohammad Rezaul Karim Siddiqui, Advocate, Supreme Court, Bangladesh. So Mr. Siddiqui will be talking about the existing interventions and policies on poverty elevation and whether they adequately address the need for the people, especially in line with people with disabilities, and what challenges remain so that we can properly measure and address the gaps. So please, can I request Mr. Siddiqui to strictly remain on time, and that is 7 minutes. I open the floor for you, sir. Thank you very much.
Hi, thank you, Sarmapa. Since there's time constant, I'm leaving the introductory spaces. Coming to the point, firstly, I would say existing laws and policies on poverty alleviation are not fully compliant with the Convention on the Rights of Persons with Disabilities, like CRPD, popularly known as CRPD. Though we have some very good laws for protecting rights of persons with disabilities. For example, we have Rights and Protection of Persons with Disabilities Act 2013. This law enlisted 82 specific activities aiming to create an inclusive and barrier-free society for the people with disabilities. For the alleviation of poverty, extreme poverty, we need an inclusive environment and atmosphere. And this is why this law and even the CRPD provided some prescribed policies. Anyways, this law 2013 recognized right to employment, inclusive education, reasonable accommodation at workplace and educational settings, accessibility, social protection, access to social protection, and many more rights. This law have enabled aggrieved person with disabilities to file complaints seeking compensation if any of the rights is violated by any natural or artificial person. We also have Neurodevelopmental Disability Protection Trust Act 2013. If these 2 laws are implemented properly, if other policies plans are amended or developed in the light of these laws, existing laws and CRPD, adequate standard of living would have been ensured for every person with disabilities in the meantime, after the enactment of laws in 2013. But what we see, you all know about this. However, another point is negative portrayal of persons with disabilities or negative messaging about disabilities is a huge barrier for participation of people with disabilities in public and private spheres, even accessing the employment opportunities or other settings. This is why the rights and protection of persons with disabilities has criminalized this type of activities through media. Accused persons and media houses may be punished with imprisonment, with 3 years, 3-year imprisonment. But after the independence, 50 years of independence, we are very sadly seeing that renowned television channels like Channel I, airing the telefilm like Ghotona Sotto, where the messages are spreading that scenes of parents result in the children's impairment. These are the primitive concepts. How we are, where we are living.
So there is a storm going on in where some of the connections may come as interruption. So I would request our viewers to bear with us. Sorry, Dr. Siddiqui, your connection was interrupted, but please do continue. I was just speaking to our viewers about the disruptions that could be happening because I hear there's a storm coming in Dhaka as we speak. So please do continue.
Okay, thank you so much. So, so I'm just trying to depict, giving you a scenario where we are actually living, or to what extent our society is accessible for people with disabilities. I think time is running out, so I just try to present some recommendations to bridge the gaps. As I already said that there are laws, there are policies, but those are not being implemented and our situation are not improving. Poverty is being alleviated, but not for us. That is applicable for other persons. If clearly I would say persons without disabilities may be benefited from the programs, but person with disabilities, this community, the largest marginalized community, are actually excluded. Anyways, if we want to fill the gap, bridge the gaps, we must have to follow the maxim: nothing about us without us. The person with disabilities and their representative organizations must be consulted and meaningfully engaged during policy making, program designing, and monitoring as per CRPD mandates. And the second one is the CRPD must be at the core of inclusive employment for persons with disabilities, must be emphasized as an urgent action to redress the injustices that people with disabilities continue to face in the labor market. And the third one is implementation of laws and policies need to be monitored, and necessary actions need to be undertaken by both the state parties and UN agencies and development partners at all levels of planning, implementation, and impact assessment. Programs must ensure full and effective participation of persons with disabilities. And lastly, I would say that we must have to consider about the access of persons with disabilities to the social safety net. That is a huge challenge, huge problem. Our persons with disabilities, especially those with high support need, and like under marginalized, underrepresented groups like persons with intellectual disabilities, psychosocial disabilities, deaf blindness. These people need to be included in every income generation activities. And so I should stop here. Thank you so much for listening me. Thank you, Salma, over to you.
Thank you so much, Mr. Siddiqui. You have been bang on time, and you get a special brownie point for being exactly on 7 minutes. Thank you very much indeed. So like you said, disability and the inclusion part of it is very, very important. And some of the disabilities are not always apparent. There are hidden disabilities. And as much as we focus our policies on the disabilities that are apparent and that are targeted, we also be mindful and get a deeper understanding of the hidden disabilities factors and assess them properly. I think there is a big, giant gap in terms of understanding it properly. Thank you very much. So the last speaker of the first session, I am opening the floor to Ms. Messing Nawa, and she is the Program and Policy Officer, Safety Net Reform, Social Safety Net Policies and Program Unit of WFP Bangladesh Country Office. And she will be focusing on what policy would they will be recommending to strengthen our social safety net program. So the focus will be on social safety net and how safety nets could adequately address the need for indigenous communities and what are the challenges for these communities to address extreme poverty among indigenous households. So over to you, Ms. Nawar, and your time will be 7 minutes. Thank you.
Thank you so much. I think the keynote speaker and as well as other our previous speakers already talked about the different safety net policies. So I will not actually repeat those things, but despite the other different challenges in Bangladesh, we know that we have very relatively comprehensive policy framework on social protection, and Bangladesh government adopted in 2015 a national social security strategy, which suggested number of safety net program in life cycle framework. And according to Hayes data of 2016, 28% of the populations are benefiting from this safety net program. However, there is an important policy challenges that has emerged concern income inequalities and regional disparity of poverty. That government has taken in highest consideration in their 8th five-year plan, and their intent and government intends to strengthen the implementation of national social security strategy during the 5-year plan. And if I want to specifically recommend to strengthen few strategy for our safety net program, one is already most speaker already spoke about it, the social protection policies for urban, because it's a leading challenges, particularly after the COVID-19. And we know that 90% of the safety net programs are designed and implemented in the rural areas. So these trends are holding back the country's progress on ensuring to decent standard of living for all. So second policy strengthening recommendation would be nutrition sensitive social safety net policy. So because we know that Bangladesh is progressing well for managing the chronic malnutrition, the measure shows that stunting and underweight declined 28% and 22% respectively, but still mother and child nutrition with diversified food consumption and micronutrient deficiency is very crucial that we really need to address. And nutrition is one of the issues, is not only for the mother and child, but also is important for every population, starting from pregnancy, newborn up to old. So to ensure the nutrition for all following life cycle approach, nutrition sensitive safety net program policies are very important to strengthen further. And last one policy I would recommend, that is like shock responsive safety net policies. We know that Bangladesh is continuous to experience the consequences of global climate. So on top of that, COVID can remind us how a devastating and prolonged shocks like COVID-19 can easily derail the poverty progress and create new poor. So shock responsive social safety net can introduce by providing additional support and services during or before the crisis to the social safety net beneficiaries, as they are the most vulnerable population, so that they can make them more resilient to cope up with the stress and shocks. So these are the policy recommendations for the safety net program. And if We also talk about the targetings, problems in the targetings, as well as consolidation of different programs. But one thing so important, that is that improving systems, particularly the grievance redress mechanisms or grievance redress system, so that rights holders' voice are listened and ensure the transparency and accountability of duty bearers. So now the second issue was how the safety net programs, or what I think the safety net programs is adequately address the need of the indigenous community. I think the national safety net program, we have lots of policies like our constitutions, the National Social Security Strategy, 8th Five-Year Plan definitely recognize and gives equal rights to every citizens to accessing the social safety net as well as other government services. But if you see, there are only few explicitly targeted towards the ethnic minority and indigenous communities. Safety net programs targeted to these communities are available in the country. And few of them are implemented under the Ministry of Chittagong Hill Tracts for the population of Chittagong Hill Tracts, and few are targeted to the excluded populations such as Dalit, Bede, tea garden workers. But there are no specialized safety net for indigenous communities. Those are living in plain land, where 80% of the indigenous populations lives in the country. Generally, national flagship programs, allocations for specific location determined based on the poverty, sometimes in the nutrition, based on the program objective. So anyone can access to the national safety net program if he or she meets the eligibility criteria. However, national safety net programs are not designed considering the context and unique need of the indigenous community. So marginalization and exclusion may left many vulnerable groups at a risk of being left behind on the country's path to development. My third question was like, what are the challenges do the indigenous communities face that need to be addressed to tackle the extreme poverty? Actually, we have to consider the extreme poverty in the multidimensional approach, which is constituted not only the consumption, but also income, education, health, and other facilities. So we have to understand and realize the challenges faced by the indigenous communities to tackle extreme poverty through multidimensional lens. In Bangladesh, there are more than 54 indigenous populations. They speak more than 35 languages. However, Bangladesh has not adopted UN declaration on the rights of indigenous people. So these groups recognized as an ethnic minority. And according to Hayes 2016 data, shows that poverty rate almost double than the national average in Chittagong Hill Tracts, Rangpur Division, and some upajalas of the Mymensingh. Those are the most upajalas are concentrated by indigenous population. So indigenous people's perspective has been ignored in many national policies. So there are some specific policies exist, but remain largely unresponsive to the specific needs of indigenous communities or ethnic minorities. So we have to revisit existing policy framework to bring the perspective of indigenous communities and their unique needs. And in terms of the poverty, as we've seen that their poverty rate is higher than the national average. So we have to pay greater attention to allocate more budget, particularly for the education, health, food, and nutrition security, and employment generation. And by making the safety net program more efficiently targeted and creating more space for their participation. And another big problem for the poverty is for indigenous people, that is scarce resource, including land. One of the major problems for all indigenous community or ethnic minority communities is land grabbing by influential people. Policies to protect land of ethnic people have not been adequate. So political commitment of the state is very important to protect indigenous communities and their land. Another one area is, I think, the basic social service. So it has to actually ensure that by the different local institution, local government, they really need to ensure the basic social services are available considering the need of the local people. If needed, the different separate ministries or department will be recommended for the indigenous community or ethnic minority. Currently, there is only one ministry, Chittagong Hilltrex, which doesn't fully represent the whole indigenous population or ethnic minority population of the Bangladesh. Employment opportunity and employment potentials are very limited for these groups. We have seen that like Dalits have very limited access to employment beyond their traditional profession. Only 6% households are engaged in formal sectors. So more job opportunity need to create targeting this community. And as we've seen that there is no specific safety net designed for the indigenous population. So we have seen very few indigenous people were able to capitalize the benefit of national safety net programs to enhance and create the sustainable livelihood, because these programs do not consider the variation of their cultural diversity and livelihood pattern. So to design any program for them, their diversities should be considered. At the end, I will emphasize not only the policy and practice need to be more focused to them. It should be non-discriminatory and respectful to human rights for all. Thank you so much.
Thank you so much, Ms. Nawar. I think you have pointed out very important gaps that needs to be considered for actually have a realistic approach to elevating extreme poverty at all levels in all sectors of the country. And it needs to be absolutely all-inclusive as well. Thank you very much. And with this, we come to the end of the first session of our panel presentation, and along with the keynote speaker. And I would like to thank all of you who have been part of this first session. Dr. Bidisha had to leave, unfortunately, but the rest of you who are here, I would like to go straight to the question and answer sessions. We are just 10 minutes behind. So I would request whoever is answering, please do be brief and try to address it as contained as possible. But further, we can provide further answers via email. So one of the first questions we had was from Kevin Billing. Kevin actually mentioned on what basis has Bangladesh's progress against poverty has been measured. I think we have actually had a lot of discussions on that, but if there is anything in particular you think we have missed or any pressing aspects that needs to be addressed, I would request the panelists to mention them, because I think we quite had a diverse discussion on this. Anyone want to pick that question up from Kevin?
No, I think, it has been addressed quite well so far. Yeah.
Okay, so let's move on. So we had another question, and this was for Fatima Jahan. And the question is from Zaim Al-Ehsan. And he asked, how viable would a large-scale conditional cash transfer scheme be? So did you hear the question, Ms. Jahan? The question was, how viable would a large-scale conditional cash transfer scheme be? Because you mentioned about cash transfer schemes and all. If she's not, sorry, I think like I said, there is a storm happening in Dhaka as we speak. So it could be that her connection is not properly connected. But I would like to say that someone mentioned, Faiz Ahmed mentioned that cash transfer without required knowledge, skills, and follow-up assistance did not work, already proven. So we actually had a discussion on cash transfers and the gaps in it. So that is something.
Yes, just to add a few points on that, to supplement it. So during COVID time, we have actually digitized the cash transfer process to a certain degree. And the CPD studies have shown that cash transfer that has happened through mobile phones as mobile money has been more efficient more direct, and the targeting efficiency also improved. As we speak, the government is actively pursuing digitization for cash transfer for the future. So we expect that it will only become better. Now, the political pressure in the grassroots is there, which continues to affect the safety net program. Some of our speakers have spoken about it in the grassroots. It continues to affect. Now, I mean, within that challenge that we have, I believe, I mean, we have also seen evidences that cash transfer works better than, let's say, food transfer or food for work schemes and so on and so forth. The reason being that the households' need vary so much that the cash transfer allows them to use it as per their need. In my research, what I've seen is that, let's say in a cyclone affected area, when there was a cash for work initiative, they were using the cash as a savings to restart or regenerate their IG. And some of them were using it for food stock. So the point of cash transfer is that we can't really program we don't really know what exactly the people will need. And therefore, when you do the transfer, then they can use it as per the need, and that allows them to be protected against, let's say, informal borrowing, which is a major threat to vulnerability. Now, when we talk about conditional cash transfer, let's say there is unconditional cash transfer, which usually happens in a very relief situation, so on and so forth. But conditional cash transfer is happening because we want them to, let's say, adhere to certain actions which are going to, let's say, contribute to long-term improvements, right? Now, that is related to the multidimensional poverty aspect, and that is also related to what I was saying in my keynote, that we need to change this aspect of cash transfer from being just handouts to being systemic. So, I mean, to what degree a conditional transfer would work in that aspect, we still don't have cases and evidence. That is, I'm not aware of it, but I do see the need of it in the future. And therefore, probably we need to start trialing it in certain capacity and scale it and see how it works and what the challenges are.
Thank you. Thank you very much for this very lengthy explanation. But I think that would be appropriate in terms of the, I think, concerns raised in terms of this cash transfer. I am aware of time. We did have very, very interesting points mentioned, and these are all points of information and food for thought. One of the things was from Dr. Mohammed Khalid Saifullah. He mentioned that income-based or consumption-based poverty measurements are important, but we should use multidimensional poverty measures meant for a more comprehensive picture. I think that's really, really good one. And Faiz Ahmed, he also mentioned that the definition of graduation should be that is another way of having another debate for another time, I think, but it is very, very important. Saif from ILO also mentioned that there should be a rights-based approach when we talk about the indigenous rights and their exclusion in the process, but also mentioned that we still don't have a Food Security Act, which is, I think, very, very good point, that there needs to be a proper, clearer understanding and policy leeway of where we go forward from here. So I would like to go to the second session because we are already 15 minutes behind. So I would like to introduce my panelists for the second session. And they are Dr. AKM Atikur Rahman, Professor, Department of Economics, School of Business and Economics, North-South University. We've got Humaira Aziz, Director, Women and Girls Empowerment Program, CARE Bangladesh. We've got Anwarul Haq, Social Development Advisor, British High Commission, Dhaka, Bangladesh, and Dr. M.A. Baki Khalili, Department of Business Administration, University of Asia Pacific. I am going to, if I could request all my participants to mute your microphone unless I call you and open the floor for you, because there's a feed. Before I would like to keep asking you to continue putting your questions, which are fantastic, in the chat box, and be mindful that it will be taking up at the end of our second session, which is another Q&A session to follow. So without further ado, welcoming Dr. AKM Atikur Rahman, Professor, Department of Economics, School of Business and Economics, North-South University. And North-South University has been one of the partners for these webinars. And he will be focusing on the separate measures to analyze urban and rural poverty, whether that is really needed or not. And if so, why? If not, why not? And what measures are currently used to improve these for his disposal, and he would like to propose. So Dr. Rahman, over to you.
Okay, thank you very much. Excuse me. Thank you very much. Can you hear? Okay.
Yes.
Respected colleagues, panelists, and participants. First, I'd like to thank the organizers for inviting me to an exciting session on poverty eradication, in which I have very limited experience to work. Probably because North-South is a participant, that's why I have to talk something, but I don't think I'm that expert to give some alternative definition of poverty. But still, I will try from my experience as a citizen of Bangladesh and as a student of economics. I will basically try to add focus on how urban poverty differs from that of rural and other related issues. So in that connection, what will come, we'll see the need of alternative measure of poverty. You see, our keynote speaker, Rubaiyat, and also my colleague, Dr. Simon, made actually a lot of important things, which are already in my talk also. So I don't know, there could be some repetitions. If you sum up the facts of poverty and poverty reductions in the last 2 decades in Bangladesh, you can see lower poverty rate in urban areas, growth poverty reduction, elasticity of poverty reduction with respect to growth has declined. I mean, although growth has increased, poverty reduction is placed down. And then one reason could be due to lower consumption growth than GDP growth. Of course, consumption growth, our savings rate is increased, but consumption growth didn't increase that much. Secondly, despite poverty reduction, proportion of vulnerable people did not change, did not decline, it remained almost same. Finally, more importantly for today, urban poverty reduction has been leveled off. If you see these facts, why such trends? Why poverty reduction? Why not vulnerability reduction? Why urban poverty reduction is almost leveled up? Is this a mathematical asymptote for urban poverty? Say it is going down, now came down to 7.7% or 8%, so cannot go down further? Or there is a measurement problem in poverty, or urban poverty needs to be measured separately? That issue comes in question in this context. Previous studies showed that none of this single approach is sufficient to identify the target people, target poor people, to design some poverty reduction strategies. Right? Now, if you look at the nature of urban versus rural poverty, first of all, you see Bangladesh is going on rapid urbanization. Some of the studies I see, they made that by 2030, urban poverty would increase huge amount. But I don't see that way, because who actually becomes urban poor? The people who basically do not have much in the rural areas, they come to urban areas. Someone comes to have a better life. Someone just come to live for having some living. So if during the COVID, as you said, people was more vulnerable than the rural people, so many people are going back to rural areas. So many of them will not come back to urban areas, even COVID goes away. So I, to some extent, disagree that by 2030, there will be a huge number of urban poor people. Probably not. Urbanization, then urban manufacturing. So urban sector, the basically manufacturing sector plays the important role in urban poverty reduction. Although majority or many of the people works in urban informal sector, like service sector, informal self-employed service sectors. These are the sectors which has been hurt most by the COVID, as you know. Rural, on the other hand, they're most dependent on agriculture, and other non-farm activities which are least affected by COVID. So that is that we see that vulnerability is much more on the urban poor than on the rural poor. Now, if you come to the social safety net issues, for social safety net issues, the thing is opposite, that it's not opposite, total number of poor people is higher in the rural areas. So, but in terms of percentage, you can see only some 18% of urban poor gets social safety net, but about 36% people has access to social safety net. And social safety net, although government spends a budget more than 3% of GDP, it says, not 3% of budget, but actually it comes down to less than 1% if I target it to poverty only. So others are like pension fund, boysko bhata, vidhava bhata, this type of thing. So not all of Mukti Juddha bhata, not all of those are targeted to poverty. So poverty targeted social safety net is less than 1%. So that is not too much, that is actually less. So one policy comes here that government should work on increasing social safety net. Particularly the, if I see the, so vulnerability. So one of the things our previous speakers said that graduation process. So my focus is to see whether you can define things. To my knowledge, Bangladesh government, the cost of basic need approach, the basket of goods probably remains same for last 2 decades. So this basket needs to be redefined. What is poor in 20 years back and what is poor today may not be the same thing. So this actually the basket needs to be dynamized. It should be adjusted every 5 years with a survey or so. So, and it should, of course, the basket is different for urban and rural areas, but that's one thing we should think about if we want to improve. Secondly, the deprivation approach may be applied identifying extreme poor in the urban areas, particularly as we have seen in previous speakers, the large number of people, some 6% or so, have the disabilities. So if I do not go to deprivation of those who have access or not, so we should add this approach, not only going to just consumption or income approach, but to deprivation approach to identify who does not have access to some basic needs, identify them as poor. We should go there. And it is already discussed that multi-dimensional approach should be used there. In the rural areas, social capital is strong. In the urban areas, social capital is weak in the sense that if a people is vulnerable, if a poor people doesn't have work, if he is sick, he or she, not only he is losing income, but also he has to spend for treatment and hospitalization. So what I see the solutions is like different type. Like you see, I see many of our even housemates, they feel comfortable to go back home if they feel sick, if they have some disease, because they can easily access to Upazila hospitals, they can easily access to district hospitals. But in Dhaka city, if you look at health situation, the poor has very minimum access to government hospitals. They are not only small in numbers, but also they have fewer access because a lot of corruptions and other things there. So in terms of solutions, how can we improve the condition of urban poor? First of all, we say trickle down poverty reduction effect probably has some limitations. In the early years, like late 90s or early 2000s, our poverty reduction rate was faster. That's because of probably trickle down effect was working better. Now, poverty has reached to a level almost close to some asymptotic level. So in this case, intervention is needed. Intervention by NGOs, intervention by governments, intervention by other social workers, and this needs to be coordinated. To trickle down, particularly trickle down may not reach to the extreme poor. They cannot find it. I had a limited experience to work with BRAC right after my graduation, like some 30 years back, more than 30 years back. You see, we see even within the same group, some people comes up, some people remain stagnant. So people are not same. So those who remain extremely poor, I think for them, safety net measures, for those special measures should be taken by the government and other NGOs, and actually the poverty reduction programs by different organizations is focused in some of those, I think.
Thank you.
So I'm more knowledgeable now with all those, practitioners who were presented before. I become knowledgeable there.
Yes.
Extending social net knowledge, particularly in urban areas, as only 18% of urban poor has access to social safety nets. So we think there is scope for extending. As I said, urban poor has not good access to healthcare system. So government can come up with them either health insurance or health subsidy. But before that, you need to track them, right? Who are there? Now there's very easy of doing this. Go to the slums, you can see how they are spending on. Go to the Patho-Shishu, how they are doing those. So many people are working with them, but what you think, integrating government, NGOs, social worker, and individual efforts, all needs to be coordinated, unified as much as possible.
I'm just mindful of time because
I'm almost done. 1 minute, maybe less. Facing challenge of automation. One of the things we have to face now, see the garment sector, the major role played in poverty reduction in urban areas is the garment sector, but garment sector is going for automation. So this will reduce the demand for labor. So we have to come up with a skill development program, training program, skill development program. And finally, formalizing, I can think, formalizing the informal activities to a large extent to informal sector. Some living in slum is not desirable, but you think like in Bhasantek, in near Mirpur or cantonment, this sort of low-cost housing should be provided by the government at a subsidized rate. Health coverage, I think, it has been increased. And schooling facilities for slum children and Patho-Shishu should be extended. Now, how the government and the NGOs and other should work together and how to identify, as much as you need to coordinate. So I'm not an expert. I just talk out of my own thought. Thank you very much.
Okay. Very much. Thank you very much, Dr. Rahman. You did very innovative interventions that could actually bring in change and add to growth and bringing people out of extreme. Thank you very much for your input. Moving swiftly to our next, Humaira Aziz, Director, Women and Girls Empowerment Program, CARE Bangladesh, and she will be talking about the importance of the non-farm income for extreme poverty alleviation, and she would also be talking about the intervention and policies that could be necessary to support engagement of women in extreme poor households to diversify occupation. And it's a very big sector and not an easy task to maintain it in just 7 minutes, but I would request Myra Aziz to please comment.
Thank you very much. I'll try to do in less than 7 minutes. Good afternoon, everyone. I think, many of you know that women empowerment and gender equality is the central focus for CARE Bangladesh. So what we're trying to do now is we're trying to learn from the experience of graduated pathways of extreme poverty within the frame of inclusion and gender equality, well-being and decent work. We're trying to understand the pathways that we were, or the strategies that we were implementing, the outcomes or whether they work, or does all those pathways that we were sort of promoting in our development practices lead to empowerment and therefore sustained graduation or a sustained outcome for the extreme poor. And we're trying to draw those lessons from both the work that we have been doing, which was not really specifically focused on, which didn't have a specific focus on gender transformation, and also from the work that we have been doing for that are specifically designed on addressing issues, dimensions of, gender equality and inclusion. So I'll also be giving an overview of a practitioner. I'm not a theoretician and I'm not an economist. So based on what we are getting from our groundwork, that's where we will be reflecting on. I think non-farm activities, why we feel that that has been important for us is because we feel that it is still a critical life choice for survival for many, many groups, particularly women. Sorry, I'm having it. particularly for women, youth, adolescent girls, and the marginalized population. And the other important thing that we feel is it is important is because of the transformational gains that it can give you if the approach is really innovative. And if the approach is designed in an innovative way that valorizes the services or contributions of women or other marginalized population, it does give a transformational gain. So therefore, we have been trying to work with a lot of non-farm kind of sectors, which includes computer operation, driving, electrical house wiring, mobile services, handicrafts, telecommunication, and IT. And perhaps what I'm just sharing my learning from the work that we have been doing with married adolescent girls. Perhaps that's the most challenging group, because you have someone who has already taken a burden of poverty, extreme poverty in her family, and then she becomes a victim of child marriage, and then she goes into a home where none of her rights are acknowledged and recognized. Now, in future, or even in the past, we have been dealing with that kind of extreme poor groups, which will have those kind of complex social dynamics. So therefore, I think it is very important as an organization for CARE to look at what kind of approaches would work. And I think my learning is from that work that we have been doing for such a long time. I think what worked for CARE is having an aspirational and a choice-oriented strategy, which means that we wanted to highlight certain strategies, or we wanted to develop an approach that helps to build aspirations of the group and gives them a kind of at least a menu of choice on which they can build their life, rather than saying that, this is the sector where you have most jobs and therefore it is important that you acquire those skills. That was a problematic kind of a pathway for us, because we felt that the groups that we were particularly dealing with, youth, they had different sets of aspirations in terms of their future life and their career choices, but also for women as well, because they had different kind of challenges in their context. And what we also saw was that approaches that are challenging the stereotypes was also or demystifying the myths. So when we started working with female youth, everybody said that female youth can't be entrepreneurs, they can't set up shops in markets because the social structure or the social kind of social structure would not allow it. But when we went into the work, we felt that there is a readiness amongst many people. Of course, there are blocks, but so then your approach has to take into consideration some of those aspects. And therefore, I think the other kind of more, at a macro level, the challenges that we faced was when we looked at the opportunity structure for these groups, we felt that, the opportunity structures were very territorial. All the kind of service structures are, divided into divisions, districts that may be good for easier operation of administrative tasks, but these groups needed, centers that are spatial, that are mobile, that are close to their communities. As soon as we started setting up those centers, services, there was a triggering impact, like, the social norms that we felt would block the paths was not so much of a big issue anymore, because we were able to build that confidence and that sense of safety and security for many women and girls and their families. The other that we felt was really important to have for youth and even for women was to sort of have occupational collectives, which helps to facilitate that kind of life cycle based approaches into sort of dealing with eradication of extreme poverty. So that was also very critical for us. And we felt that, the gender gaps actually has to have, we need to do a lot more of contextual analysis of gender gaps in the market, where we felt that certain regions have maybe female participation in certain sectors, but there are quite a lot of opportunities that are growing in that particular location, but that requires a kind of investment from a macro perspective to sort of, help women or girls or youth to sort of maximize from those gaps. So therefore, I mean, I think investment on some of these gap areas is critical moving forward at a kind of macro level, which helps to build technical knowledge for the secondary and tertiary sectors in the non-farm kind of opportunities that are available. And thirdly, what we saw is we work with Robi Telecommunication, to sort of include adolescent girls, married adolescent girls in their value chain or in their distribution system as retailers. What we saw was that the behavior of market actors needs to also sort of be influenced, where they're not coming in just from a corporate social responsibility point of view, but where they're coming in to develop a skilled workforce that will be also very helpful. So there was a behavioral aspect where private sector organizations not necessarily always wanted to share risk or make investments that are not 100%, that they were not sure of, that they will get benefit from. So I think those are kind of broadly what is coming out of our learning from the experience that we have gathered over a period of time, looking at women, girls, youth, and marginalized groups of extreme poor people. Thank you.
Thank you so much, Humaira Aziz, and bang on time. I'm ever so grateful for this. But what you have tried to cover in the 7 minutes is very, very crucial. I think one of the predominant factors that has been going on throughout this discussion has been how women bear the brunt of being at the extreme end of being in extreme poverty, and how they need to be elevated because the burden they carry are double, triple, and at times 4 more. Because if you add disability, if you add indigenousness, if you add non-employment, there are too many burdens to carry in order to progress and get out of that vicious circle. Thank you very much for your presentation. Moving on to our next panel member, and that is Anwarul Haq. Anwarul Haq is the Social Development Advisor from British High Commission, Dhaka, Bangladesh, and he will be talking about some of the priority areas for interventions that is targeted to extreme poverty eradication in Bangladesh, obviously coming from a donor's perspective and the practitioner perspective as well, I reckon. So what do you think should be the role of development partners supporting Bangladesh, especially in the COVID-19, post-COVID-19 recovery phase? So over to you, Mr. Haq, and your time will be 7 minutes.
Okay, thank you, moderator. And thank you, organizers. This is a unique opportunity, and let me very briefly share actually the question asked to me. So what are the priority areas for Bangladesh to really consider? I would say that Bangladesh has again innovated the ultra poor graduation program and really has shown the world that how even ultra poverty can be addressed. Now we have substantial knowledge right now in Bangladesh. So means in the last 15 years, I would say that we really know actually what are the dynamics, and we discussed today already many of those dynamics already. So we know exactly how to tackle those. Now, things have been done sporadically. I would say that different development partners, different NGOs, government projects have done these programs sporadically. This is the time now to think about a nationwide ultra poor program. And that means actually government needs to lead that. And that also means that government need to spend money, because ultra poor program actually is designed in a way that the poor people will have access to assets, will have access to income generating opportunities, and then things starts move on from there. So considering that, we know that there is an investment need, but this needs to be considered in a way that if an ultra poor households can graduate out of poverty, actually, that means that they are no longer the burden of the country, the burden of the society, rather they would be able to contribute to the economy and prosperity of Bangladesh. So if that is considered, then policymakers can think about an innovative approach of thinking about a nationwide program. And I'm sure that development partners, NGOs, all can come together to do that. I would say the second priority could be actually thinking about again, related to what I already said, that I think we need to really focus on GeoNGO collaborative model here. Because what we are seeing, even with targeting of the safety net, there are issues around how to reach out the poorest of the poor. The accurate targeting is always an issue. And there is another dimension we have not discussed in this forum today, but which is very important. And this is related to really address the psychological well-being of the poorest of the poor, because these are the people who are struggling generations after generations, and they are struggling with despondency that life cannot be changed. So there is a sub part of it actually which needs to be addressed, and any structural program led by government may not be able to really crack that, we know. And that's the advantage in Bangladesh. You have that, we have NGOs, we have civil society organizations, they can come together and they can really partner with government and develop a collaborative model there. Third, I would say that I mentioned this in the chat, but that we discuss a lot about graduation, and which is based on certain criteria. But I think on the extreme poverty front, we need to now think about resilience, especially in the Bangladesh context, because of climate vulnerability, because of various other factors. Really, we need to think about how to develop a process that really ensures that if there is a shock, like cyclone or flood or anything like that, the household would be able to cope. There could be shocks like even COVID-19 that can be also addressed. So on the second part of my question, actually, related to COVID-19 scenario and what can be done. So I would go back to Masing from the WFP. She has already mentioned that Bangladesh needs to really think about an adaptive and shock responsive social protection that needs to be established here. Means we have seen that in the COVID-19 cases that government has the money, government has the willingness to reach out to the poorer, but because of lack of system in the urban areas, because of lack of like a database who these poorest of the poor are, there was huge struggle happened. On the other hand, if you compare in our rural areas where there is a strong social safety net program already happening, that was easier actually, and the quick cash transfer to the beneficiaries was possible, and the impact was much better. So it has come out. So if we have existing social protection programs and that option that when there is a crisis, things can be quickly, horizontally and vertically expanded, that can be expanded, then things can be done differently. So that's why we need to now think about adaptive social protection actually. And think about social registry system or single registry MIS system, having those kind of things which will enable government to really act when there are crises or any kind of need to really come to the poorest of the poor. And the other thing is that in the COVID-19, again, it become quite clear that vulnerabilities in the urban areas are quite immense. And we also know that means urban poverty, urban dynamics would be with Bangladesh because the urbanization is a reality here, and the poverty dynamics are different. So my previous panelist has touched upon that. I will not go into the detail, but we need to really make sure that I would not say new poor, I would say that transient poor actually, who are poor because the economy is shut down, and there are struggle about income generation and many other things. Now, really how to make sure that these people do not fall back to poverty in a permanent way, rather how we all can come together and think about really help them to cope with this crisis, and they would be able to really be resilient actually with our support. I think that should be another area where we could focus. Over to you, Honorable Moderator.
Thank you so much, Mr. Hawk. That this is really valuable and input, especially when the global crisis, the COVID-19 crisis, has shown us that how much is needed for this targeted approach and identifying the gap. And Bangladesh could really learn from the best practices elsewhere and see where no one is left behind. Otherwise, the progress and the bid to go towards the middle income country could have a serious blow if this opportunity is missed or not addressed in a timely manner. But thank you very much. Thank you for all the panelists. So we are moving to the last speaker, Dr. M.A. Baki Khalili, Department of Business Administration, University of Asia Pacific. And Dr. Khalili will be addressing what the interventions and policies that supported extreme poverty eradication in Bangladesh in the last 50 years. So he is going to take us in this journey of the intervention and policies. I am looking forward to hearing what actually worked, what didn't, and what were the lessons learned and intervention necessary from the lessons learned to move forward, and how important that would be targeting effectiveness. I am going to open the floor for Dr. Khalili. Sir, over to you.
Thank you very much, moderator. I joined this session a little bit late as I had another preoccupation, but I have reviewed the keynote paper by Rubaiyat, and I think he has done a wonderful job in highlighting on the critical issues that you want me to address. In fact, Rubaiyat has addressed all those issues quite effectively. So I will be basically, whatever I will be saying will be repetition of some of the issues that Rubaiyat has discussed and other panelists have already highlighted. But let me first address this issue from the government perspective, that what has been the government approach to alleviation of poverty. So basically, it is the first, what we know as the Washington consensus, that economic growth leads to poverty reduction through its impact on employment and output. That is the major approach of the government in reducing poverty, including extreme poor. So that will be one part. And certainly empirical evidences are there. We find that even in the case of rural areas, that agriculture development has positive effect on poverty reduction and extreme poverty reduction as well. The technological use of technology has certainly contributed to such reduction, but it has its limitations. Why these limitations? Is because this growth is not inclusive, and it's not also systematically distributive. And when it is not, then certainly a big group of population remains outside to reap the benefits from the economic growth that Bangladesh is achieving. Second is, government is aware that there will be certain segment of population that cannot be addressed through the economic programs, like normal income opportunity or employment opportunities. There will be some who will need continuous support. And that is the extreme or vulnerable group. And that's why government has, over time, expanding the volume and size of government social safety net program. And every year in every budget, we find that this is being increased quite at a higher rate. And that is the second part of the government policy, government social policy. But third part, which is non-government part, policy part, is the NGO MFI programs in poverty alleviation. And that program evaluation not only limited to access to microfinance, but it is access to financial and non-financial resources. So the evidences from this long, since 80s, early 80s, the evidences that we through the 20s, we find that NGO MFIs have programs have contributed significantly in reducing poverty, and in particular in the recent decade in addressing the extreme poverty. And we have heard it from the panelists also. They explained what it is. But what has been the benefits of and how NGO MFI's participation have contributed? Let me, in the context of Bangladesh, let me cite a data that we are aware of, that some 38 million people are members of microfinance programs in Bangladesh. And that is almost the 1/5 of the total population, individual total population. That's a huge penetration. And in one of my recent, one of my study, nationwide survey on access to finance, we found that not only that moderate poor have access to financial resources of microfinance institutions, but also the extreme poor households also have access to financial. But there remains quite a significant part that it is, as I have mentioned, that it is not pure access to finance that solves the problem of poverty alleviation, including extreme poverty alleviation. What is important here that the nature, the dynamics or behavior of NGO MFIs in Bangladesh is quite different from other MFIs or NGOs in other countries. In Bangladesh, that there is no, there used to have few pure microfinance institutions, but now over time the character of these institutions have changed. There is not a single microfinance institutions that can be termed as pure microfinance institutions providing only financial services. So the institutions are providing both financial and non-financial services. But the experiences of all these, all the evidences that we find, evidences suggest that extreme poverty alleviation requires a different program, different focus. Reason being that they are different. Poverty poor, an individual is poor because she is deprived of basic resources, but that is more for extreme poor than to the moderate poor. Now, moderate poor can be easily addressed through access to some financial and non-financial interventions, but alleviating extreme poverty requires special programs because of its heterogeneity and because of its diverse characteristics. So that is why that NGO MFIs in recent decades have focused on alleviating extreme poverty in Bangladesh. So these are the 3-4 policy sets that I will say that have broadly, there are lots of micro policies also, but broadly, these are the 4 policies that have broadly contributed to alleviation of poverty, including extreme poverty. But why this alleviation, there is alleviation of poverty through this? What lessons do we get in terms of, like one of the panelists focused on non-farm economic activities. And this is what we have seen, that NGO MFIs, along with mostly promoted the non-farm economic activities, in addition to financing the agricultural sector. And that has been, it is empirically now established because of their participation, because of the role of non-farm economic activities that microfinance sector has contributed to GDP significantly in Bangladesh. And this is empirically. Now question comes to it. So my conclusion on the first question is that the extreme poor got to be treated separately and it needs to be focused. And I have mentioned that because of its diverse nature and heterogeneity that we find. So what ought to be directed for in future? I think those policies that we have seen, I have highlighted, will be needed. But what micro level policies will be required? You know, for the rural areas, employment, labor market, in the context of labor market, your micro enterprise development should have major impact on output, employment, particularly for extreme poor. So that is one aspect that needs to be. Secondly, that it needs to be, there is a second is coordinating the social safety net programs with the non-farm economic activities. So to me, that there is a need for exclusive, focused and targeted program intervention for extreme poverty. And it requires all these aspects that has been addressed by panelists: resilience in COVID-19 and climate change, non-farm enterprise, indigenous group, which is generally ignored in targeting extreme poverty. So all those got to be considered in the future to make it more meaningful and effective. The third question is targeting, whether the targeting efficiency will be needed. It is always, that need is there, because targeting efficiency refers to perfect targeting of the group, of the extreme poor. In what we say in statistics, you know, that you accept something which is not true and you reject something which is in fact true. So similarly, in case of designing a program, there may be a mistargeting. So I think this targeting efficiency is needed to ensure perfect identification of the poor, and the process is well practiced by CARE Bangladesh to everybody, PKSF and all other microfinance institutions in particular. They focus on identification, through perfect identification of the extreme poor. And this requires right from perfect, starting from project planning to FBD group discussion and to monitoring, follow-up of the program participants identified under a program. So I think my last sentence would be, yes, there is a need for target efficiency. Thank you very much.
Thank you very much, Dr. Khalili. And with that, we come to the end of all the speakers. I would like to especially thank all of you, each and every one of you, what valuable input you have provided for this webinar on extreme poverty and all the important lessons learned. I think what we get at the end of this discussion is that we've got a participation-ready population where we can have the right amount of systematic approach, long-term approach, and renewal approach to elevate poverty, that could be done. And it could be done to a host of measures that's been proposed by our panelists and speakers. And I think it is invaluable for anyone who's watching today to take lessons forward. With this, we do come to the end of today's webinar. And prior to that, I would like to make an announcement on behalf of the organizers that we do have, although this is the last series of the last episode of the first series, I'm sorry, but the second series is just around the corner. And what we have been told that there will be other areas in future where the webinars will be held, and that would include women empowerment, RMG manufacturing and other industries, agriculture, migrant workers, climate change or blue economy, financial inclusion, SME development. So please do keep your eyes open. It will be around this autumn time. But before I finish, there should be mention of the partners who have been a part of this webinar series since the beginning, and they have been really, really tremendous for providing support and resources. So for WASH, we had WaterAid as thematic partner, WaterAid Bangladesh. For startup, we had Patao and Ankolas Bangladesh. For ICT 4D, we had BIID, and Extreme Poverty, we have Care Bangladesh. Nutrition, GAIN Bangladesh. On health, we had Simprints Technology. Education was Next Gen Edu. And Rohingya crisis, it was ICCO and Care Bangladesh. And also the areas, event partners would be the media partner, Financial Express, sharabangla.net, Colors 101.6 FM, and academic partner, North South University, youth engagement partner, NSU Young Economist Forum, that is YEF, and communication partner, Windmill Advertising, ICT Solutions, Empower, Social Enterprise Limited, creative partner, Printer Graphy. So as you can see, this webinar was not a one person or one organization show. It took a lot more, a lot of partners who made this a success. So like I said, what from now? We have the whole series going to be put as a documented research paper, which will be available later on for everyone. And to access them, please go to the website innovationbd.com/Bangladesh Miracle, and you can subscribe the YouTube channel and LinkedIn, as well as other social media platforms. Gosh, I feel like I have been an advertiser, but it is all important information. I hope you have heard and shared it with among your networks. And the last session, as promised, there will be a question and answer. So we don't have many. Most of the things have been covered in the chat function and by our speakers, but there are a few comments and one question from Saif. And before we depart, I think it's important to address this as well. So he's saying, how are poverty reduction program going to accommodate the key trends and we face now, and such as automation, 4IR's impact on jobs, evolution of gig, digital economy, a national bid to transition to general form of economy. What is new RMG going to be? So if anyone wants to sort of take that question, it will be really good. So basically 2 parts. One is, what is the future of RMG going to be? The impact of the poverty reduction programs, and how are they going to pick up the trends from now on, such as automation, 4IR's impact on jobs, the technological side of it. Anyone from the panel? I'm not going to put anyone on spot, but if anyone wants to pick that up, very briefly.
I can start.
Yes, go on, sir.
Okay. So it's a very timely question, actually. We all know that technology will drive the development, and what you have written in the chat bar, these are the realities. I think that's why it has become very important, especially on the extreme poverty discussion, to make sure that the children and youth from the extremely poor households, they have access to education and access to skill program. I think that should be a way forward, and that's where we should pay focus. This is our chance. The demographic dividend is here, and if we cannot use this properly, these are the households actually who will be left behind and will continue struggling over another 40 years. So that's my take, that let's put efforts on really making our education and skill development inclusive and non-discriminatory. Over to you.
Thank you so much. Thank you. And one last question, and that will be the last, because I am mindfully aware that we are awfully over time. So the last question will be, it's a good question from Kevin Billing, and he's saying that Bangladesh has always been doing really, really well in terms of rural finances and how much has been a major contribution in reduction of poverty. But do we really know what damage COVID-19 has done to this system? And I think this is a very future focused and very important question, whether there has been any studies, any targeted approach in this area to learn, to evidence the damage done. Any panelists would like to take that very briefly?
I can answer that question, yes. And I appreciate Kevin for making the point that that rural finance has worked in reducing poverty, and certainly the discipline and the process that we experienced before the COVID-19 has been vastly affected because of lockdown and the reduction in income level of the poor people, particularly their purchasing power. For it is not only the rural economy was also locked down quite for some time. And empirical evidences, there is no systematic empirical evidences, but there are some evidences, piecemeal evidences are available that COVID-19 has damaged on both the demand side and supply side of rural finance. On the demand side, that it has created a new set of what we call new poor, and that incidence of poverty has increased. And on the other hand, the sustainability of the, in terms of program implementation, sustainability of the institutions providing financial services has also been affected. But there is certainly, this is a question that I would expect that a serious study, empirical study is required to assess the incidence of effect.
Thank you very much, Dr. Khalili. And with that, we come to the end of today's session. Thank you everyone who has been a part of this, and I wish you well. And please do keep your eyes on for our next series, and I hope they will be equally brilliant. Thank you.
Thank you everyone for joining. We will be closing the Zoom session now. Have a good day and see you in the next series. Goodbye.